Hello, students. This is your first lecture. This is actually an audio lecture. You will also have a copy of these lecture slides. So actually, I am going to go through these slides and point out the important things that I need you to know. So again, this is the first lecture slide. This is actually fall 2020. And the first thing I want to talk about is the role of the pharmacy tech. So keep in mind, this is actually based on a technician that works in a retail setting, particularly CVS, Walgreens, Walmart, your supermarket pharmacies. So the role of the pharmacy technicians assist licensed pharmacists by performing duties that do not require the professional skills and judgment of a board-certified pharmacist. For example, typing in a prescription, there's no law that says a pharmacist must type the prescription. The pharmacist's main job is actually to make sure that the final product is correct. So before the medication gets bagged up and the patient picks up the medication, the pharmacist does the final check. The pharmacist does not necessarily have to put the pills in the bottle. There are a few exceptions. Some companies prefer that C2 prescriptions like Adderall, Oxycontin, that those just be filled by the pharmacist only. But there's no law that says the pharmacist must only fill C2s. It's just for security reasons. So here are some of the duties that you will fulfill as a technician: preparing prescriptions, ordering supplies. Normally you have basically about 4 different type of technicians that are in the pharmacy. So you can have a tech and training, and I believe all of you have your tech and trainee license. The tech and trainee license actually gives a newly registered technician, you have actually 2 years to actually learn the field and to prepare for the PTCB. You also will have a what they call an inventory tech. Inventory tech is the main one that orders the supplies, as you see in number 2. Maintaining patient records and billing, that's the job of pretty much a certified tech. And also you would have a lead technician. A lead technician is usually the most skilled and versatile technician. You have to master pretty much drop off, production, inventory. You basically know everything about the field. Sometimes the lead technicians are the ones that actually train the tech and training. Maintaining inventory, again, is another responsibility of a tech. Pharmacy technicians may be called upon to mix pharmaceutical preparations under the direction of a supervision of a pharmacist. So you have pharmacists that actually do compounding, and technicians can also compound, but obviously they're under the supervision of a pharmacist. They're also responsible for assisting in the care and cleaning of the pharmacy equipment. Everybody is. And here's the role of the pharmacy technician. Some of these you can pretty much read over. I'm just going to point out the real important ones. So these are just different roles of the technician, and they definitely vary. So I'm going to point out if there's anything particular that I want you to actually know. I'm going to mention it in this audio video lecture. You see right here more responsibilities of what the pharmacy technician can actually perform. Just basically look over this. I don't need you to memorize any of this. The next slide talks about what the pharmacy tech cannot do. And there's a lot of things that the pharmacy cannot do. One of the most important duties that a pharmacy cannot perform, a pharmacy tech cannot perform, that they usually would like to ask on the PTCB is counsel patients. So a technician cannot counsel patients. Normally the technician is at pickup, and they're usually doing the transaction at the register. And a lot of times the customer is looking at the medication, and the customer may say, oh, so what is this medication for? Can I take it with alcohol? Do I need to take it in the night? Do I need to take it with food? Sometimes you may know the answer to that question, but by law, you must say, hold on a second, let me get the pharmacist, and the pharmacist must come over and counsel the patient. Okay. Or sometimes a patient may say, oh, I'm taking some medication and I need something to help me sleep. What do you recommend over the counter? Even though it's still an over the counter medication and not a prescription medication, that's still considered counseling. Um, so a pharmacist has to counsel. Now, sometimes technicians get a little confused. For example, there are some questions that obviously every technician knows. Like, for example, if a person says, just say a person is new to medication, and they say, what is hydrocodone used for? So as a technician, you should know, or you should know very soon, that hydrocodone is a pain medication. You as a technician can give that answer because that's just a straightforward answer. That's not counseling. That's a little different. That's you as a technician know that knowledge. Again, if you're unsure, just always relay that question to the pharmacist. If she asks, what is hydrocodone used for, and do I need to take it with food, or do I need to take it at a, will it make me drowsy? If she asks an extended question where it requires some counseling from a pharmacist, that's a little different. But if they just ask you, what is hydrocodone used for? What is amoxicillin used for? Those are just basically a straightforward answer. One's a pain medication, amoxicillin is a antibiotic. But if they ask more in-depth questions, then you will get the pharmacist. So this is really the only one I really want you to pay attention to, because they usually, every PTCB question, they'll ask a question similar to this, of which you cannot do, and this is the key one: counsel patients. And you can just look at the other things that you cannot do, but this is the main one that I want you to know for this class and for the PTCB. What training is required to work in a community pharmacy? So I do want you to remember this law. This is called Emily's Law. I'm not sure if you seen this law before in Dr. Henderson Curran's first half of the semester, but Emily's Law is the reason why you're actually taking this course, and it's applied in all 50 states. And this just gives you a little synopsis of what happened. So Emily's Law: pharmacy technicians hold people's lives in their hands. Because remember, technicians do the majority of the typing in the prescriptions. They do the majority of the production. That's production means you putting the actual pills in a bottle or the liquid in a bottle. So pharmacy technician holds people's lives in hands, as evident by the fatal mistake by a pharmacy tech in Ohio when 2-year-old Emily Jerry, who was receiving her last dose of chemotherapy. So obviously, if she was taking chemotherapy, you can tell that she was very sick and taking some serious medication. With an excellent prognosis, wrapped her head, screamed, and cried before falling into a coma. Excellent prognosis means there were chances that she was going to improve in her health. She died 3 days later. And after they did a little investigation, shockingly, the medication had been compounded with 20 times the normal amount of sodium chloride, the standard being 0.9%. So this happened in a hospital pharmacy, not in a retail. The parents rightfully blamed the pharmacy tech, and the supervising pharmacist who signed off on it. So what happened, once they did a little investigation, the pharmacy tech, and this happened many years ago, so time's a little bit different. So what happened was, the pharmacy technician did a incorrect calculation, and the way she calculated, it ended up being 20 times the dose. Now, the problem was two big things. The technician got hired literally off the street, so she didn't go through any kind of tech program where she learned different types of math problems or whatever. She basically was just hired off the street with little to no background in pharmacy at all. And she did a calculation, and she admitted under oath that it looked like it was too much, but she just went with it anyway. The other thing, which was the biggest problem, is the pharmacist signed off on the prescription. So remember, the pharmacist's main job is to make sure everything is correct. Um, if a technician types in the wrong prescription, the wrong drug, or pulls the wrong drug, the pharmacist has to catch that. The way it's set up right now in all 50 states, the pharmacist assumes 100% liability. So even if a technician typed in the wrong medication under the wrong patient and another technician pulled the wrong drug and somehow it got out to the patient, the pharmacist cannot say, well, I didn't type in this medication and I didn't put those pills in a bottle. So it's not my fault, it's the technician's fault. Oh, how wrong that pharmacist is. In all 50 states, it's the pharmacist's fault 100% because the pharmacist's main job is to make sure what leaves the pharmacy is correct. So the pharmacist has to double check all the technicians' calculations. They have to check the pills. They have to make sure that the technician didn't make any mistakes. That's why they pay the pharmacist the big money to do that. So always remember that it's always the pharmacist's fault if a mistake gets out of the pharmacy. And in this case, I would assume the pharmacist just got real laid back and probably said, oh, she doesn't make that many mistakes and it looks right. And institutional, it's a little bit more dangerous because you're dealing with medications that they all look the same. They all go into a clear IV bag, and you really can't tell if if a technician has made a mistake unless you actually do the calculations yourself and work the problem and see if she put the right amount. Because once the drug goes into solution, everything in the IV bag looks clear. So you cannot tell by looking at an IV bag if the technician put 10 times the amount of drug that she's supposed to in that IV bag. Whereas in retail, it's a little easier to catch the mistake because if they grab the wrong pill, on the pharmacist screen, when they scan the prescription, it will tell the pharmacist what the pill looks like. The pills have codes, shapes, and the pharmacist can eye it with their eyes and tell if this is the wrong medication. So it's a little different. So this is what Emily Law does. It defines a qualified pharmacy technician. You have to be at least 18 years old, have a high school diploma or something equivalent, has passed a competency examination, and obviously this would be in Texas Board of Pharmacy. That's what the PTC board is. Also, they require all technicians, and all 50 states do this, and they do this for pharmacists as well. You have to do a background check. I don't know if you guys have done your fingerprint checks, but all board of pharmacies require that. Any person working in the field of medicine, any medical field, whether they're nurses, doctors, physician assistants, you all have to do a criminal background check. That's just required in the medical field, not just for technicians and pharmacists. And so this year, they basically updated some things. So beginning in January 2020, this is the PTCB related information. To be eligible for the PTCB or the PTCE, you have to meet these requirements. And you can just look over those. I won't actually test you on those, but it just gives you information about the PTCB. And this is just a little map, just showing you different requirements as of 2018, but almost all states now require a technician to be certified. I don't know any that does not. Now, this is pretty crucial right here. What must you know on day one? So the first thing I want to talk about, and most of you should have heard of this already, is a very important law called HIPAA. And I want you to know what the acronym means. So HIPAA, HIPAA, stands for the Health Insurance Portability and Accountability Act of 1996. That's when it was passed. I'm not worried about when it was passed, but know the acronym, because on the PTCB, they will remove one of the words and ask you, what does the P stand for? And you have a multiple choice. A lot of times they put pharmacy instead of portability, because portability is not a word that you hear every single day. And just make sure you know what each acronym stands for. Okay. So let me sum up what HIPAA is pretty much in layman's term, just everyday's term. HIPAA means, and it's all over the medical field, it basically means as technicians and pharmacists, we agree to protect a person's um, private information, or you may see it as PHI, which is private or personal health information, when you're doing a course of business. So what that means very easily is this. As a technician, you have access to people's profiles, people's very personal profile. No one walks around, or you don't, normally you don't hear conversations of people maybe at a restaurant, basically talking about their medical history or what medications they're on. People normally don't want to discuss that because they feel that's too personal. They feel basically it's none of your business what medications I'm on or what medical conditions I may have. You know, unless you're in a relationship with somebody, you may share that business, a very serious relationship, but that's not a conversation that you go around in the hallway saying, hey, I have erectile dysfunction. Hey, I'm on depression medication. Nobody walks around just talking about that. And with that said, people don't want you giving out that information to people who shouldn't know that information. So as a technician, you should not be looking at people's profile. Keep in mind the big pharmacy companies like CVS and Walgreens, I think actually all of them are now, come to think about it, since it's 2020. The big companies now, all their computer systems are shared, meaning they all connected together. So basically what that means is if I work for a CVS in Dallas, I can look up a customer that uses any CVS anywhere in the United States. So I can look up a person that lives in New York. I can just, you know, if I got their name and date of birth and know they somewhat know their address, I can pull up that person's profile. Years ago, about 15, 20 years ago, you can only pull up the profile of people that actually use your particular pharmacy. You couldn't pull up profiles all over the nation. But now you can because technology is much better. So you can basically, if you know a person who uses CVS and you work for CVS and you know their name and date of birth and a general area where they live, you can easily put that information into the computer and pull up their profile and look at what medications they on. Some technicians and pharmacists have actually been terminated for doing that. Their friends might ask them, hey, can you see what medications this person's on? I know she uses your pharmacy. And the technician thinks they're helping out their friend. Oh, okay, I'll do that. You know, no harm. And then they give that information to that person who has no business, and somehow the person sort of reveals that they got that information from a tech. And if corporate finds that out, they will terminate you. Even if it's a pharmacist, you cannot do that. So this is basically what HIPAA is. And emphasis was put on being able to communicate medical records electronically. Also, I just want to point out that you have to be careful when you're working in the pharmacy and somebody's there to pick up their medication. Like, I'm give you a little example. Just say, for example, I showed up at your pharmacy and there's 3 people behind me. This is what you don't want to do. If I'm here to pick up my medication, and let's just say hypothetically, I had 3 medications to pick up. And let's just say they were atenolol, which is a blood pressure medication, Lipitor, cholesterol medication, and let's just say Viagra, which is for erectile dysfunction or whatever. If you're the technician and you are at the register and you say, oh, Mr. PA, you get all my information, and you look in the computer and you see I have 3 medications ready, and then all of a sudden you say, okay, Mr. PA, you have 3 medications ready here. You have your atenolol, your Lipitor, and your Viagra ready. If you say that out loud where there's people behind me that could hear all the medications that I just mentioned, you have violated HIPAA. You just basically spreaded my business to the people that are behind me. What you want to do is just basically just simply say, oh, Mr. Pierre, you looks like you have 3 medications here already, and then basically retrieve the medication. So you only mentioned that you have 3 medications, which could be anything. The people behind me have no clue what they are, and you just basically retrieve the medication. One thing I want to point out that happens a lot, um, where in this case it wouldn't be a violation of HIPAA, but just try to be smart about the situation and realize where you are. Sometimes when customers pick up medications, they will say, just say the same scenario, and I'm looking for 2 medications. I'm looking for Lipitor and um, atenolol, but you look in the records and you show that I have 3 medications ready. The third one is the Viagra, and I'm only here to pick up 2 medications, and you tell me, oh, there's 3. And then I ask you directly, oh, what's the name of the third medication that's ready for me? Technically and legally, if you were to say Viagra and there were people behind me and they hear what you say, that case is not a really technically legally a violation of HIPAA. And the reason why it's not is because I asked you clearly what's the name of the third medication, and then you just answered my question. You said Viagra. That really isn't a violation of HIPAA since I asked you a question and you gave me a direct answer back. But if that scenario happens, still, be thoughtful. You're the bigger person, and just grab the bag and show it to me without spreading my business. Doesn't matter what the medication is. Even if I ask you what's the name of the medication, just grab it and bring it to the customer where they can see the name of it, just in case they accidentally word it differently. Because sometimes customers word it differently. They really don't want everybody to know, but they'll say something, oh, what's the third medication? And they're asking you a question. And if you reply by telling the name, that's technically not a violation of HIPAA, but sometimes they don't mean it that way. They just want you to show it to them. So just kind of remember that. This is important here too, because this comes up on the PTCB. Every customer that fills a prescription at a pharmacy for the first time must receive a document detailing the data privacy policy. So it's basically, you don't have to do anything. Once a customer is in your system for the first time, the computer will automatically print out a copy of the privacy notice that will be attached to the prescription. It automatically prints out. This is not something any technician has to remember to do or have to manually print. It automatically prints out anytime a person is at the pharmacy for the first time, okay? And they just receive a copy of that prescription, and it basically says in so many words that this pharmacy vows to protect the patient's privacy. That's all it does. It's just an acknowledgement. It must also collect the same evidence of the patient's acknowledgement that the HIPAA privacy document was received. Usually this happens when they pick up the prescription. A message will come up where the customer has signed, have you received a copy of the HIPAA policy? And they usually will hit yes. If they happen to hit no, you show them where it's attached to the prescription. So basically, what is HIPAA? So pharmacy personnel must follow certain protocols for assembling and organizing patients' profiles, and under penalty of law, take care not to reveal any information about any patient outside the pharmacy workplace. We may not discuss or transmit prescription data to anyone other than a patient, parents of children under 18, and appropriate healthcare providers. This is very important too. If a parent happens to call and wants to know what medications her daughter or son has on file, the first thing you need to do, you have to verify, who the patient is or whatever. If the person is really that mother or caregiver, if they want to ask specific questions about a medication, if that person that they want to know about is 18 and older, you have to say, I'm sorry, ma'am, or if it's the dad calling, or I'm sorry, sir, but I cannot reveal that information. Your child is 18 or over, and they have certain privacy issues. So in the medical field, once you're 18, your parents cannot access your medical records. If you are under 18, you're considered under your parents, under your parents' supervision, and your parents can call up, and once you know once you have verified it's the parent, they can ask any questions about your medical history. Like a mother can call up, and if the child is 16 and she wants to know what medications is on the profile, you're allowed to give that information. But once they turn 18, they're considered an adult, and the parents, if they want to know what medications the child is on and the child is at least 18, the parents have to call the child and get that information from the children. U.S. technicians or myself as a pharmacist, we cannot give that information once the person reaches 18. Every pharmacy must have a training program, and this you will receive on HIPAA. It's very easy. And this just tells you information about the fines. They're big fines if they catch you violating HIPAA. They'll fine the pharmacy, and if it's an individual, you can be fined depending on the severity of it. But it's a very serious issue. So you can just look at that information of the HIPAA fines. They don't play around with that information. HIPAA does not play around. What are some ways HIPAA can be violated or breached? So pharmacies can be held liable for employee violations. And just look over this one that happened in 2013. A Walgreens pharmacist in Indiana reviewed the prescription health records of a woman who had once dated her husband. Courts determined that because of this HIPAA violation, Walgreens should pay a $1.4 million fine, even though they have strict privacy policies in place and the employees admitted she knowingly violated the company's rules. That's just the way the courts ruled. So basically what happened, a pharmacist basically gave information out to someone else that she had no business doing. And the person find out and they sued, and the Walgreens had to pay $1.4 million. After a lengthy legal battle, the Indiana Court of Appeals let the initial ruling stand, sending a stark message to pharmacies across the United States. If your employees violate HIPAA, you can be held liable. That's why almost all companies, especially medical companies and pharmacies, they have a lot of strict training to their employees about not violating HIPAA. Okay. And then you can just basically read the rest of what happened. So some ways HIPAA can be violated or breached. Trash can get you into trouble. That's why almost any pharmacy you go to, at one time before they enacted this, when we threw away trash, everything went into the same trash can. So sometimes we have like extra prescription labels with personal information. And the way we trash that, we would just put it in the regular trash, throw it in the dumpster. Believe it or not, back in those days, I would say this is about 10, 15 years ago, you would have people that would literally go to pharmacies and go into the dumpster and open up those trash bags and basically steal private information, because sometimes it'll have the person's date of birth, address, information like that. But now we can't do that anymore because trash bags that are in the dumpster, none of it has any kind of pharmacy information or private information if the pharmacy is following the rules, because all private health related information, it goes in a special coded bag that's different from the pharmacy trash bag, from the clear trash bag. These are color coded bags. These bags are picked up by special companies, so they never are on the outside of the building. A company comes in and picks up those bags and disposes of them, so they're never out in the public. Okay, so that's how they actually do that right now. And every pharmacy follows that, hospitals as well. You go anywhere, any hospital, any pharmacy, if you were to look in the trash bags, you should never find any kind of private information. They either get shredded or they go in specially coded bags where a specific company picks up that information and they destroy it at their facility. And you can look at this. This happened with actually CVS back in 2009. A reporter just wanted to show how the system was flawed, went through the trash of a CVS pharmacy in 2009. They found that employees were disposing old prescription bottles with labels that had health information still intact. So remember, sometimes people come with their old bottles to get refills, and they hand you the bottle and they tell you, oh, just throw it away, the bottle, I don't need it anymore. And back in the days, they used to throw those bottles in the regular trash, and that still has person's name and information on there. But bottles like that, anything with prescription information, it goes in separate bags. It doesn't go in the regular trash bag. So what are some ways HIPAA can be violated or breached? You can actually just read through this. These are just more FYI ways of violating HIPAA. What are some ways HIPAA can be violated or breached? A little bit more. The layout of a pharmacy can get you into trouble. Many pharmacists have been actually remodeled so they could be HIPAA compliant, because one thing you don't want to do is be able to walk up to a pharmacy as a regular customer and be able to look in and steal private information. So a lot of pharmacies have been redesigned where a person really can't walk up to drop off and see any kind of personal information. The computers are back a little bit more where the person can't see what you're typing. So pharmacies have definitely redesigned their pharmacies where HIPAA cannot be breached. They usually have, I know now they have the 6 feet distance down, which actually helps with HIPAA, but typically during consultation, a customer is supposed to, if there's 2 people in line for consultation, the second person needs to stay a distance back so they don't hear everything that the person that's in front of them is saying. So there's a lot of different ways that you can breach it if you're poorly designed. Here's a little bit more. Loose lips will sink ships. This is an old saying. This is pretty common. You have to be careful with this as well. When you're in the pharmacy, gossip can get you in a lot of trouble. If you're working on a patient's profile, you don't need to be yelling to another person, hey, this person has HIV. Hey, Mr. Jones has his herpes medication or whatever medication. So talking loud and just gossiping, you can violate HIPAA, because somebody could actually hear that conversation, and that can get you in a lot of trouble. So you remain professional at all time. What are some ways HIPAA can be violated or breached? Continue prying eyes lead to big consequences. A few days after the reality television star Kim Kardashian gave birth at Cedars-Sinai Medical Center in 2013, 6 employees were fired for inappropriately accessing patient medical records. Bottom line is, obviously celebrities are still human, and they go to pharmacies and hospitals as well, and they have medical records. So most people can easily find out a celebrity's, you obviously know the name, and if you can Google and get their date of birth, and you can try to pull up their medical records. But bottom line, if you're not filling a prescription, or if a doctor's office is not calling, asking you information about the person's profile, you should not just be randomly looking up people's profile. And a lot of the systems now, since they have better technology, they can tell, because every technician has their own code when they access the computer. They can tell if you're looking up a person's profile and you're not filling a prescription. If you randomly are just looking up a person's profile, it will flag to corporate, and they will investigate why you were looking up this person's profile and you were not filling a prescription. So be careful with that. Basically, the best information I can tell you, if you're not filling a prescription for a person, or a doctor's office is not calling, asking you to look up a person's profile, you do not need to be in that person's profile, whether they're a celebrity, a relative, or whatever. Okay, so moving on to the pseudo-threat laws. So this is a big issue because in this country, even in Texas, the Dallas area, we have a large methamphetamine or crystal meth problem. So just to give you a little history of the way it used to be, Methamphetamine is a C1, so it's a very dangerous drug, but it has no medical use. You can only use that medication to actually get high or whatever, known as crystal meth. So this is methamphetamine. It's a dangerous illegal drug, a C1 street drug, commonly known by the street names crank meth or crystal meth or ice. Um, and actually, just to let you know, this is just FYI. You see the word methamphetamine. Um, it's similar to a drug that is actually legal because it does the same thing. It's in the same family. Amphetamines are your stimulants, like Adderall, Ritalin. They're the same family, just that the crystal meth, because they actually do the same thing. Crystal meth, if, if sadly you know people on it, is known to keep you up for days. If people use crystal meth that haven't been to sleep in 3 or 4 days because it's a stimulant. The stimulant actually keeps you going. Same thing with Adderall, same family. It's a stimulant that keeps you up and it keeps your memory fresh. But this one has no medicinal value, crystal meth. It does a lot of bad things to you because it's made synthetically. In order to make crystal meth, you have to have Sudafed. Sudafed at one time was just found uh, out there with the cough and cold medication. Sudafed is used as a decongestant. If you got sinus problems, it opens you up. So it's a decongestion, but you have to have um, Sudafed to make crystal meth. There's a lot of other thing that goes into crystal meth. It's a very dangerous drug to make if you're trying to make it at home. I'm pretty sure many of you heard of crystal meth labs. Sometimes they can explode. They've been known to explode, and they have killed some people or cause blindness because of the fumes. Very dangerous to make if you don't know what you're doing. Yeah, but so as I stated, it's a very dangerous drug to make, but you need lots of Sudafed to make it. If you don't have Sudafed, you can't make crystal meth. So Sudafed, and it's abbreviated PSC, is the key ingredient in methamphetamine. And at one time they tried to control it. So one time it was basically over the counter. You can kind of tell what people were doing because they would buy like 20 boxes of Sudafed at one time, or they would steal them. And then the next thing they did was to take the Sudafed and place it in the pharmacy, and you had this log of that you have to sign anytime you purchase Sudafed. The problem with the log was each store had their own log, so it was just a written log. Just you wrote down the person's paper, you wrote down on a piece of paper, little log book that you had, the person's name, you had their driver's license, the amount of Sudafed they purchased. The problem with that was it wasn't electronic, so a person can go to Walgreens and buy the maximum amount, then go across the street and to CVS and buy the maximum amount. So there were ways to beat the system because everything was just done on paper. So now they went electronic, and the computer system basically keeps track of it via scanning your driver's license. So you got to have an ID, and you have to purchase crystal meth through the pharmacy. The rules have changed a little bit since the pandemic because they used to have at one time people coming through the drive-through trying to purchase Sudafed, but the law was at one time that you had to physically come in the pharmacy to purchase Sudafed. They kind of relaxed that rule right now because of the pandemic, so they want as much contactless interaction in the pharmacy as possible. So now the Board of Pharmacy has kind of waived it where you can actually purchase Sudafed through the drive-through, but you still need your driver's license and everything else. And this is just the way it looks, just a little FYI of how Sudafed looks. Pills, crystals, some people melt the crystals and inject it. Comes a lot of different ways. This is what I need you to know, because this is the federal law. And the good thing about it is that everything is computerized where you don't have to keep up with this. So here's the Sudafed law is this. So it's kept in the pharmacy. The daily sales cannot exceed 3.6 grams. So back in the days, what you would have to do is if the person was purchasing a box of Sudafed, you would have to look at the quantity size and then on the back multiply that by the milligram, and it couldn't exceed 3.6 grams. So that was the old fashioned way. I need you to remember this because they still ask this on the PTCB. What is the max daily amount of Sudafed you can purchase in one day? And it's 3.6 grams. So definitely know this by memory. And 1 month is 9 grams. So they usually ask one or two. I haven't seen them ask this one yet because some people can get Sudafed mail order and it's 7.5 grams, but definitely know the 3.6 grams daily and the 9 grams monthly. Okay. The computer does everything for you, so you don't have to add it up anymore. The biggest count I believe it comes in is 96 count. If they already got too much for the month, once you scan the first box of Sudafed that they're purchasing, if they say, well, I want one more of the 96 count, and you're not sure if they went over the limit, you don't need to worry because once you scan the second box, the computer does all the work and it will tell you if they have exceeded the daily or the monthly. Because remember, everything's electronic and you do it with your driver's license. So you don't have to memorize everything. The computer will tell them right away, you cannot sell this. The person has already exceeded the limit. So don't worry about physically doing the math in your head, but do memorize for the PTCB 3.6 grams daily, 9 grams monthly. Some states have made Sudafed a controlled substance because they have just terrible, crystal meth rates in their city or their state. But Texas is not one of them. So this is just FYI that some states you have to have actually a prescription from the doctor to purchase Sudafed, but Texas is not one of those states. It's just Texas, you just have to purchase from behind the counter in the pharmacy. And I mentioned some states, these are the states that have made it a controlled substance. The closest one to us is obviously Arkansas and Oklahoma. And these are just different Sudafed products. What usually gives it away is the D. So you got Mucinex D. The D signifies that it's Sudafed, Claritin D, Zyrtec D, Avocold Sinus. This one has the pseudoephedrine. So the D usually stands for pseudoephedrine. Do not get this confused with Sudafed PE, like Paul Edward. Sudafed PE is phenylephrine, which is a different product. It's similar to Sudafed in the way it works, but not nearly as powerful. And you cannot make crystal meth with phenylephrine. So there's a synthetic over the counter that's kept in the aisles. Sometimes you'll see Sudafed PE. Again, that stands for phenylephrine, which is a synthetic form of Sudafed. They don't have to show their driver's license for that because it's not pseudoephedrine. It's just a synthetic version of it. Emergency contraceptives. This is no longer a big issue because all of it is now kept over the counter and maybe in locked cases. But at one time it was. This was the emergency contraceptive pill, also known as the morning active pill. At one time it was restricted for 18 and up could purchase it. If they were under 18, it would have to be on prescription from a doctor's office. But now it's just flat out open to women of all ages. So technically a 14-year-old could purchase it. Again, it's over the counter, but most pharmacies keep it locked up. But that's all you really need to know about this. This used to be a big issue at one time. It used to be kept behind the pharmacy. These are some of the common brand names: Plan B, the most popular, One Step, and Next Choice. And again, this is for, if any of you don't know what this is used for, if a female has unprotected sex and she fears that that the condom broke or whatever happened, the man ejaculated or whatever, Within 72 hours, if she can purchase one of these pills, um, it can actually prevent a pregnancy. That's basically what it is. So it's a emergency contraceptive. And these are just some of the common ones. Plan B, next choice. Aftera is a new one. One thing I want you to know, this is kind of important. You have to take your religion and personal beliefs out because this could actually get you in trouble. Um, you cannot refuse a sale for personal reasons. Like if someone was to take a Plan B to the counter and you look at it and you're like, oh, I know what that's used for. I'm not selling that to you or whatever. And the person asks, well, what's wrong with it? And you say, well, I'm Catholic, or it's against my religion, or, I believe you should have used safe sex. If that gets back to human resources, you will be terminated rather quickly. You cannot put your personal beliefs um, into this. Even a pharmacist, you just can't do that. So I just want to let you know, you can't refuse sales for personal reasons. Okay, so what are different reasons? What are different ways prescriptions enter the pharmacy? So you have the written or manual, which is slowly getting outdated. You got the fax, which again is also slowly being outdated. Emails is for refills only. Telephones still being used. E-scribe or e-prescribing has become very, very popular. E-prescribing is defined as the process of electronically generating and sending in prescription orders so that physicians and other medical practitioners can transmit an electronic prescription to a pharmacy directly from the point of care. So this is becoming really popular. It's fast. It has less errors. Just an easy way to actually get medications into the pharmacy. It's super neat, super fast, super efficient. So this is becoming really popular. Still, the written one is a little bit more popular, but eScribe is overtaking it. And the main reason they went to eScribe is to prevent medication errors. Because eScribe, everything on a prescription is written out just the way you see these words. You don't have like the SIG codes, or some doctors that you may have heard have terrible handwriting. Everything is legible. Just as you can read everything on the slide, that's how they come over in eScribe. You also have store-to-store transfer, store-to-competitor transfer. That's basically if you have a prescription at Walgreens and you want to transfer it to CVS or vice versa, you can do that. I'll go into a little bit more detail with that a little bit later in another slide. What are different types of prescription classes? So you basically have, now you got really 4 classes. Either the medications are going to be OTC, which is over the counter. So if they're over the counter, you may say, well, why is that? What does that have to do with pharmacy? Well, the reason why is that some OTC medication are prescribed by insurance plans such as Medicaid. This is the main one. And they will cover over-the-counter items, especially like Tylenol and ibuprofen. Technically, that's over-the-counter, but Medicaid will cover that as well. Most private insurance like Aetna, Caremark, Blue Cross Blue Shield, they won't cover over-the-counter medications, but Medicaid will for sure. So that's one class of drugs. Then you have non-controlled medication, which is the same as dangerous drugs. So this is basically a drug that's not habit forming or over the counter. Habit forming means you get addicted to it. Obviously, over the counter or medications that you can buy, that you can purchase without a prescription. Non-controlled are basically anything like blood pressure medication, seizure medications, depression medication, antibiotics, thyroid medications, on and on, just anything that's basically not controlled and not over the counter. Then you have your controlled medications, which are pretty serious. There are 5 distinct classes of controlled medication. and they're usually abbreviated C1, C2, C3, C4, C5. And then you have, and again, just want to point out, some controlled medications have been added and removed to one class or another. For example, tramadol at one time was non-controlled, and a few years ago it has become a controlled substance. Tramadol is the same as Ultram. Little update here, there's a new class of medication called specialty medication. This is a new class of drugs which are basically high dollar medications for the treatment of rare and or chronic disease. Most of these medications are not even stocked at your normal CVS or Walgreens. They're stocked at special medications, special pharmacies called specialty pharmacies. At these pharmacies, they just stock high dollar medications. Customers cannot even go to these pharmacies because they're a closed pharmacy. They mainly just process specialty medications, and they either deliver them to the doctors or actually to a pharmacy for the patient to pick up, to the patient's address, or to the doctor's office, one of those three, after the patient has paid for the medication. So it's a special class of medication that's becoming very popular. They're high dollar medication. They're not stocked at the pharmacy. They stocked at buildings that you wouldn't even know are pharmacies. And the reason why is mainly because of the cost of these medications. Some of these medications are 20, 30, seeing some as high as $50,000. They're very expensive medications. And again, here are some examples of them: Humira, Gleevec, and various chemo drugs. Now, just going back to the class 1 drugs of the control classes. So you got 5: C1, C2, C3, C4, C5s. So C1s are basically the highest potential for abuse, but you won't find these in your pharmacies. They have no acceptable medical use. These are your bad street drugs. So not commercially available or legally dispensed in the United States, but they are C1s, highly abusive. And these are some examples. Heroin. This one is controversial and probably shouldn't even be on this list. Marijuana. Marijuana is technically, it's now, since it's legalized in some states, it's more so of a C2 now. It really, some sources you'll still see it classified as a C1, but it's really not a C1 anymore. So you can put a star next to this one, or even if you want to, you can cross this out. LSD, ecstasy, crystal meth, those are all C1 drugs, drugs that have no benefit health-wise. Then you have your C2s, which have very high potential for abuse, but have medical uses, which can lead to severe psychological or physical dependence. So as far as the prescription medication, these are the ones that have the highest abuse potential. One thing I want you to know is that all C2s cannot have any refills. This is in all 50 states. Okay, never can they have refills. Some drugs that fall into this class are your amphetamines, your attention deficit medications like Adderall, Ritalin, your pain medications, your oxycodones. In 2014, hydrocodone since we have a big hydrocodone problem in this country, it used to be a C3, but they moved it to a C2. Fentanyl, all hydrocodone products. You see, cocaine is actually a C2. Most of you probably asking, well, why isn't this a C1? Cocaine is actually an anesthesia drug. It's actually a C2. It's a drug that actually numbs you. Some hospitals actually still use it, but it's very rare because of the price. Because again, it's an anesthesia drug. It'll numb you really quick, but since they got better drugs and much cheaper drugs, most pharmacies don't order them. But technically, cocaine is a C2, not a C1. Crack would be a C1, but not cocaine. Then you have your C3s, which are less addictive than C2, obviously. Usually, most of these drugs are typically your anabolic steroids, basically. Your C3s, your C4s, and your C5s typically can have up to 5 refills within 6 months if authorized by a physician. Tylenol with codeine, anything with codeine that's in tablet form is generally a C3. And then basically any anabolic steroids or C3. So one way to memorize C3s is any combination with codeine is a C3 and anabolic steroids are C3s. C4s are pretty much anything anything that's a controlled substance that's not a opioid like oxycodone, doesn't have codeine, and is not an anabolic steroid, pretty much is a C4. And these are your benzodiazepine, like your anxiety drugs, your alprazolam, your Valiums, Xanax. Phentermine is a popular weight loss drug that's very addictive. So they fall into the C4 category. And then finally, the C5, pretty much they're easy to recognize if you get one of these questions on the PTCB, because they're basically liquid medications that have some kind of combination, and usually it's codeine. So when it's codeine in liquid form combined with a liquid, it is almost always a C5. If it's codeine with a tablet form, it is a C3. So when you think of C5s, they're almost always liquids with codeine, pretty much. Few exceptions. And as you can see, in some states, some are sold without a prescription, but in Texas, you need a prescription for any codeine combination product. So Schedule 3 to 5 can be transferred between pharmacies one time. Actually, I'm going to have another slide that explains this a little bit better, so I'm going to skip this section here because I have a slide that actually breaks it down much better. And a way you can actually tell a controlled substance is by easily looking at the bottle. All of them will have a C, and then they'll have a Roman numeral. So this is Oxycontin. So you see C right here, and then the 2 Roman numerals. This is Tylenol with codeine. This is C with the 3 Roman numerals. This is the diazepam. You have the C here with the Roman numeral 4, letting you know it's a C4. This is Cherry-Tussin. This is a combination liquid medication with codeine, so it's a C5. C2 prescriptions in Texas. Actually, I'm going to stop right here because I want to break this down into another slide, or actually talk about it in a different slide because it gets a little tricky. So I'm going to stop here, and I will upload the second part within 24 hours. So I'm going to pick up on C2 prescriptions in Texas on the next slide. Thank you very much. And I'll end this first part.